Okay, county numbers are confirmed cases 67, negative cases 914, pending lab results are 100, total persons tested 1,081, recovered is 29, and death is 4. Those are the health department numbers.
All right, thank you, Commissioner Shelton. Russell, you want to go over MCH numbers?
Yes, good afternoon. So far, Medical Center has tested 613, 613. 44 of those have been positive. Currently, right now, 3 positives in the hospital. 2 of those are on the 7th floor. 1 is still in CCU on the ventilator. We've had 534 negatives with 35 pending. And patients under investigation right now, 5 on the 7th floor and 3 in CCU. So our numbers are holding pretty steady, pretty low. So far, been a pretty decent week.
Right. Kristen, did you want to add anything?
Absolutely. Yesterday, we spoke about a second nurse that had been exposed and tested positive for COVID. She is at home quarantine, and so I just wanted to make some points of clarification from some more information that we got after our call yesterday. So she was in the building a little later than what we had originally had reported. I believe her last day to work was a couple of days before she was tested. And what we previously had reported was the week prior. We had the miscommunication on dates in regards to finding out when she was exposed versus what time she stopped working. She was in the building, reconfirmed that with a mask on at all times, even into some patient rooms. So I did validate that we have about 8 patients that we're going to be calling by the end of today to notify them that she had been on the floor and at some point could have responded to their room if they were in need of water during her rounds to check on patients, just simply because as a charge nurse, that is her role. So we followed up in with those patients, and we'll be making sure that they are contacted, and if they're exhibiting any symptoms, that we encourage them to go to the 42nd clinic or follow up with their primary care physician.
All right, thank you, Kristen, for that. Dr. Sarah Vannon, I know you're going to be the one joining us just solo from ORMC today. You have an update on ORMC's numbers and anything else?
Yes, ORMC's numbers. We've done 262 tests total. 13 of those have been positive, 239 negative, 10 pending. 9 of those tests were on the rapid machines, and all 9 of those rapid tests have also been negative. Other than that, I don't have anything else new to add today.
All right, thank you, Dr. Sarah Vannon. I want to give the mayor a chance. Do we have any more updates, Mayor?
Currently working on the plan. We're using a lot of industry requirements, like this one right here is from Texas Restaurant Association. Working through all the CDC stuff. So the plan to reopen is in the works, but I'm going to be working most of the weekend on it. So, and then I'm going to get with the doctors first part of next week and have a conversation and kind of look forward.
All right, thank you, Mayor. All right, let's get to some media questions. Looks like Marcos, you're first up. You have any questions?
I do not.
All right. Danny?
Yes, Mr. Mayor, are you concerned that as stores and restaurants start opening up, that because of the downturn in the economy, that the majority of the people won't have disposable income to go out?
I think, we'll just have to see. One of my bigger concerns is maybe finding employees, because the unemployment that was given at the rate, from my understanding, from the rate they were being paid, plus they get $600 on top of that. I know some restaurants are concerned about a shortage of employees, because it will be easier to stay on the unemployment than it will be to go and maybe make less than you're being paid for right now.
So what are you how have you talked to any other business owners regarding that, or restaurant owners, what they plan to do?
I've talked to restaurant owners, and that's kind of a concern all the way across the board. We have hired a few people here in the last few days just to fill in for employees that have left, but it's really going to be, restaurants, it's going to take us a week to gear up if we can find the employees, plus another week, that week we'll also have to get food in. So all of the distributors have backed off on their routes and reduced their routes. So it's going to be interesting going forward.
Okay. Thank you, Mr. Mayor. I have one more question I have a question for Commissioner Shelton. My question is, how many staff members in the EOC are HIPAA rules and compliance certified?
So Danny, maybe if I can help with that, it's not, there is no certification such as that. There is courses that you take if you're in public health or if you're in any healthcare related field. So even though the Commissioner Shelton might not know how many people are, it is a requirement for every healthcare worker to take a HIPAA related course. And that would include everybody in public health as well. I hope that answers the question.
So is there any, how often do they have to get?
It's a yearly certification within the hospitals. I would assume it is no different for public health.
All right, thank you.